Good afternoon, everyone. My name is Tony Torres, and I'm currently a policy manager with San Diego County Child Welfare Services.
Good afternoon. My name is Mike Green. I'm a Protective Services Program Manager with the County of San Diego, and I manage the Indian Specialty Unit.
My name is Pierce Robinson. I'm a protective service worker for the Indian Specialty Unit for the County of San Diego.
My name is Danielle DeLuca. I am a Protective Services Supervisor for the Indian Specialty Unit.
Hi, everyone. My name is Bea Arellano. I'm a policy analyst with policy and program support, and I oversee our ICWA protocol and ICWA inquiry and noticing manual.
Hi, my name is Evangelina Wu, and I'm a senior deputy in the Office of County Counsel, and I'm currently assigned to a trial team, and I'm also one of our office's ICWA liaisons.
So thank you, everyone, for joining us. At the beginning of our presentations, we always feel it's very important to talk about our journey and where we were and where we are today. So in order for us to do that, we're sharing our San Diego County child welfare timeline. This is a timeline that includes the work that we've done with our tribal partners. Going back to 1989, the county had established an Indian specialty unit. An Indian liaison and position to help streamline and also work with our tribes when we had Native American children in our system. Our Indian liaison worked closely with our tribes, and at that time, the idea came up of developing our Indian specialty unit, similar to what Los Angeles County had established a few years prior. At that time, San Diego County tribes had several consortium programs that were serving various tribes in the North San Diego County and East San Diego County. San Diego County does have a large urban population as well, and so the Indian unit began in 1992. At that time, Indian Health Council and Southern Indian Health Council were the two consortium programs, and we worked together to establish our protocols around working with them for several years. The Regional Training Academy developed Tribal Star in 2003, and at that time, we worked conjointly with them to develop our training and continue our collaborative work. In 2006, San Diego County System Improvement Plan efforts partnered with our tribes to be part of our peer quality case review process, where we identified Native American cases to look at ways that we could improve system improvement and our collaborative work with the tribes. In addition, we participated in the California Disproportionality Project in 2009, and it was a series made up of various California counties throughout the state that looked at disproportionate number of Native American children in the child welfare system. We partnered with our tribes here in San Diego, and we came up with some projects to address disproportionality. Some of those projects included developing a video that included a Native American parent that talked about being in the system and what it was like to have both a tribal social worker and a county worker and the outcomes of her case. In addition, we developed other special projects to address the disproportionality project, including our 7th-generation work group that is still held today. And it's a collaborative work that is brought together by various community partners, county, legal, and other educational partners that come together quarterly to discuss systems issues to address disproportionality. In 2016, we established our protocol for working with Indian families and children and tribes, and we also developed our RFA Tribal Subcommittee. We can go to the next slide. So in the importance of our collaborative work, we recognize the importance why once our work was established and we had our protocols in place, we want to have our work continue. We want to make sure that we were capturing not just the best practices, but the trust and the relationships that we have with our tribal partners. We feel very strongly that we need to honor our agreements and our protocols so that if anyone did leave this work, the people that would follow, the social workers that would come to the table following our departure would continue and honor our agreements and our work. So that was why we developed a protocol. It took about 5 years of all of us coming together, but it was well worth the work. And to this day, our protocol is what guides our work. With that, I'll hand it over to Mike Green, our Indian Specialty Unit Manager.
Thank you, Tony. As Tony had mentioned, the Indian Specialty Unit was established in 1992. Currently, we have 2 units. They're divided up between our continuing services, which includes voluntary services, ongoing casework, and we have a unit of emergency response workers, also to include our court dependency investigator. We have a total of 11 case carrying workers in the unit, plus a social worker 1 who acts as a support staff and helps our social workers with visits, noticing, and other things. I think one of the real important parts that we've done is we've staffed our program really well. So our caseloads are probably a little bit lower than the average referral or caseload in the county, but that truly allows our workers to engage in active efforts with the families and really work at decreasing the number of youth that we have in open cases and in protective custody. We've worked really hard to get that staffing up there. We do all our CFTs pre-pandemic, at least on the reservation, and hopefully now after the change in with what's going on right now, hopefully we can start resuming all in-person CFTs on the reservation as well. Our unit also has 2 full-time supervisors that provide all the supervision to our workers. We do joint investigations, and I'm going to pass it on to one of our social workers who will talk about the joint investigative process that we utilize.
All right, so once the hotline receives a referral and the family has been identified as Native American, I, as a social worker, contact the tribal social worker to give them an overview of the referral, and then we conduct a joint investigation in order to best serve our families and their needs. Danielle?
And as well as the joint investigations, we also have monthly child protective team meetings with the 2 local consortiums in San Diego County. So every month we meet with either both IHC and SIHC to discuss open referrals and open cases, including voluntary cases. We do this to ensure our joint collaboration, to ensure we are providing the best support and services to the families, discuss any concerns, and also what's working well. We schedule and have ongoing child family team meetings with our tribal partners. We are always doing joint case management with our tribal partners, whether we're going out in, as well as open cases, going out to the homes and having our monthly visits with parents and or youth. We're doing that jointly with our tribal partners as well. So right from, like Pierce mentioned, from the hotline all the way down through case management, through court cases, we are working hand in hand with our tribal partners.
So one of our biggest milestones was reached in 2016 when our protocol was published. As Tony mentioned, it took about 5 years for the document to be thoroughly vetted and discussed with county and tribal partners through our 7th generation meetings. Really, our goals of the protocol are to keep Indian families together and to provide the preventative and active efforts throughout the life of the case, from the hotline all the way through the case. Our protocols are really listed, as Pierce and as Danielle have mentioned before, through our active efforts and through the work that we do to honor the establishment of our protocol. It was last updated in November 2017 or 2019, excuse me, to include all of the changes that came with AB 3176. And then a couple of other things that we've sort of noticed that we're missing from the protocol throughout from the time it was published. For example, we recognized that tribal custodians weren't identified or defined in our protocol. So that was one of the things that we added to it. Next slide, please. In speaking about best practices, we really want to highlight our partnership with San Diego State Academy of Professional Excellence and the Cultural Responsiveness Academy, which was established in 2016 in response to our awareness that there are issues about disproportionality and disparities of services and biases really in decision-making that impact the kids and the families that we serve. The Cultural Responsiveness Academy, the CRA, provides a unique learning opportunity for our staff that really emphasizes facilitated discussion, an open space for self-assessment. It provides our staff an opportunity to look internally for internal biases, as well as our systemic barriers to the families that we serve. It's an opportunity for every staff from all levels across CWS to participate. And we are happy to announce we've just wrapped up our 5th year of the CRA. Our first 2 years were focused on African-American families and communities. Our year 3 and 4 were focused on Native American families. And we just wrapped up our first year of father engagement. So next slide, please. Part of the CRA includes not just the facilitated discussions and learning opportunities in the classroom. Staff who sign up to participate in the CRA commit to a year of the learning experience. And at the end, the goal is for staff to not just change internal thoughts and biases, but also address some of the systemic barriers for the families that we serve. And at the end, staff are tasked with having to complete a field practicum project that will really help address the barriers within child welfare system. And we wanted to highlight 2 really quickly of the field activities, or 2 of the projects that were created during the Native American experience. So our first one is our ICWA field activity, which was done really, it's a learning activity that requires new social workers as part of the Common Core 3.0 training and the transfer of learning process. Historically, the ICWA field activity was not consistent throughout the regions, but this CRA project really makes it consistent for all new social workers who are completing their first year of the project. Or this project made the activity consistent among the new social workers in the region as a way to meet our local tribal partners at Southern Indian Health Council, Indian Health Council, and listen to the tribal services that are offered in our county. So social workers meet virtually in the last year with our tribal partners to really discuss some of the history that we've talked about here, and also get to meet face-to-face or virtually with our tribal partners and hear about the services that they offer. Our second activity that we wanted to highlight is the ICWA at the hotline. That project really helped train all of our social workers at the hotline, identify, ask questions of the reporting party about Native American ancestry, and really try to help identify those families who are Native American right at the beginning. If there is some indication that the family is Native, we ask the tribe. And if that is something that we are able to gather at the hotline, then our hotline workers document on the face sheet of the investigation the tribal social worker and their contact information. So if for some reason the Indian Specialty Unit were not to get that referral in their unit, any social worker in the hotline would have that information readily available for them to contact the tribal social worker and go through the case together. I'll turn it over to Evangelina.
So in line with what Bea just talked about, we do have ICWA inquiry and noticing specialists who are accessible for every region's office, and they help prepare the ICWA 030s when notice is needed, and they also assist the case carrying workers with inquiry in cases where we have reason to believe, but maybe not reason to know yet. They document all documentation about ICWA inquiry gets entered into the state database system, which is the CWS CMS. And then our office, county counsel's office, has 2 county counsels who are trained and specialized to to assist our attorneys, our deputies in ICWA related questions. And also we provide ongoing training for the social workers. We do that. We try to do it every year. We also did a training for the hotline about the importance of inquiry now that it's at the initial referral, now that it's in the statutes. And we also do our best to educate the bench and opposing counsel about the updates in the law, about inquiry and practice, and to ensure that we are in compliance with the law. So for our office, it is me and Emily Harlan. Emily is on the appellate team, so she sees a lot of the issues that come up on appeal, specifically with respect to inquiry and notice. And I try to catch as much as I can at the trial level to make sure that we are serving our populations appropriately and in accordance with the law. So with that, I will have Micah put up the contact information screen next. This is all of our contact information. And you are free to reach out to us if you have questions or comments. Thank you.